All right, let's see what it is. 39-year-old nulliparous woman comes to the office due to pelvic pressure and constipation. Constipation that have worsened over the thing. What's constipation? Difficulty passing stool. I said the word difficulty, I didn't say painful. Okay. Now, she frequently has an uncomfortable sensation of incomplete evacuation following a defecation. Menses occurs 28 days, everything is good, with severe pain, heavy bleeding and severe pain. The patient has no pain with intercourse, no dyspareunia, folks, and routinely uses condom for contraception, BMI 24, everything looks good. Examination shows irregularly enlarged uterus. If you know the uterus is irregularly enlarged, you cannot pick A. Because A, we just mentioned, that's a regular. Remember, symmetrical. It's symmetrically enlarged. So that cannot be adenomyosis, okay? Normal rectal tone. Which of the following is the most likely? See, in the uterus, you're going to be fighting between fibroid and adenomyosis. Adenomyosis is regular. Fibroids is irregular because they are masses in different places. So the diagnosis of this patient is fibroid. Is everybody clear, folks? This is a fibroid. Now, how do you connect the fibroid with this option? It is not cervical carcinoma. It is not endometriosis. For endometriosis, they should be a painful, folks, okay? So you have these two. Those two, if you narrow it down between C and D, I'm happy. Whatever you get it, I'm okay. The right answer is C here, okay? Posterior subserosal uterine leiomyoma. That means they have a fibroids on the back of the uterus. It's compressing the rectum. I'll show you a picture, beautiful picture. Look at this. This is the posterior fibroid. Look at that, how big those are asymmetrical. You see that, folks? And this is compressing the rectum. So when this patient passes the bowel, it feels it's incomplete because nothing is coming after this. Is everybody clear, folks? So that's that. Now, what is D then? Posterior vaginal wall prolapse. Okay, this is the posterior vaginal wall where my arrow is. Now, I want you guys to follow my arrow. You see how this rectum comes and nicely turns? It's like an arch, nicely turned, isn't it, folks? There's a medical condition called rectocele. We're going to pull the picture. What do you see different here? You see, instead of coming and turning as an arch, there's actually a pouch here. You see that, folks? You see this little pouch? Compare that with this picture. Here, let me bring this here. How do I do that? Wait. Okay. Look at this. How nicely come here? Versus, okay, this one versus this one. It's not coming out. There's actually a pouch underneath it. Is that clear, folks? That's called rectocele. Rectocele is due to posterior vaginal wall weakness, and they are developing. Now let's read that. Okay, very important. Pelvic organ prolapse is the herniation of pelvic structure through the vagina. Okay. Although the posterior vaginal wall prolapse can cause pelvic pressure and constipation, same thing as this question. They have pressure and constipation. Is that clear, folks? Okay. It doesn't cause uterine enlargement. I would write next to fibroid versus rectocele. You should have rectocele next to your fibroid in your book. Okay. Rectocele and fibroid next to it, and make sure you know the difference. There shouldn't be anything to do with the uterus. So how do I change this question so the option D is right? I will remove the whole examination of the irregular enlarged uterus. I would say normal uterus. Is that clear, folks? If I tell this question normal uterus, then you will go for D. Are we clear, folks? All right. Make sure you know fibroid to differentiate from rectocele. Okay, so that's that, folks. Just to see adenomyosis, look at that. Adenomyosis is, look at this, it's symmetrically enlarged, isn't it? Equally enlarged. Whereas this is irregular, folks. Look at that. That's irregular. Okay, that's the idea. Are we clear here, folks? Okay.
Can you go over that rectocele versus that whole rectocele thing again?
Rectocele have no involvement of uterus. Keep it simple. Whereas fibroid, you have uterus involved.
Yeah, but what were you saying before about the pouching and all that
Did you
stuff?
see the picture what I was showing? Do you see this pouch? In a normal person, they shouldn't have that. Okay. Normal people, it ends with this. Look at this picture. There is no pouch here. See this area, that's the difference. Not this one. Let's go to this one. A 55-year-old woman comes to the office due to vaginal bleeding. The pace of 55, postmenopausal bleeding. Is that clear, folks? The patient underwent menopause at 49. So clearly postmenopausal. And the light vaginal bleeding for the past 6 months. She has no pelvic pain or anything else. The patient has type 2 diabetes, which is managed with diet and exercise. She is obese, 38. Speculum exam shows dark red blood cell at cervical os. Bimanual exam, the uterus is small and non-tender, and there is no palpable anorexial mass. So what do you think is happening? It's almost endometrial hyperplasia or carcinoma until proven otherwise. So we have to do biopsy. The next step is biopsy. But they're asking what's causing the problem. Increased peripheral aromatization of androgen. That means if she's obese, she has more aromatase, it's converting androgen to estrogen. So she's producing so much of estrogen. Is that clear, folks? All right. No other answers can come closer to that, folks. Okay. So that's the idea. The second, if you see ectopic implantation of endometrial gland, that's endometriosis. You're not going to get endometriosis at that age. Okay. Okay, 28-year-old nulliparous woman come to the clinic for an infertility evaluation. The patient has had unprotected intercourse with the husband for the past 12 months without conceiving. See, the definition of infertility, when do you diagnose somebody infertility? After 12 months of unprotected intercourse. Okay, that's important, folks. Okay. Now, often experiences pain with deep vaginal penetration. That's dyspareunia. Is everybody clear, folks? Okay. Now, menorrhagia was at age 11 and her menstrual period occurs every 26 days. Okay, all looks good. And only thing is moderate to severe low abdominal pain. Pelvic exam shows normal size uterus. All good, folks. Okay. The posterior vaginal fornix is tender to palpation. Okay, that's what causes dyspareunia. What do you think the diagnosis for this patient? It's endometriosis. Okay, this is endometriosis. If you think it's endometriosis, what's happening? Ectopic endometrial tissue. Does that make sense, folks? It's leaving the uterus and going outside. Okay, that's the answer. What is B? What does that mean?
Can you repeat the question? It cut out.
Oh, what is B? Iman, you got the diagnosis, but then you are missing a part that in between. When you have a patient, folks, in OB-GYN clinic, right? So when you go to rotation, they will teach you. If they don't teach you that, that means your OB-GYN is bad, okay? And the first thing they have to teach you, whenever you do a bimanual pelvic exam on a female, the first thing you are expected to notice how moisture is the vaginal epithelium. Is everybody clear, folks? That's the first thing you have to say. So if you are checking a patient, if the vagina is moisturized, that tells you patient has adequate estrogen. And if you are doing a physical exam, if the vaginal tissue is dry, which we often see on postmenopausal people, it says decrease estrogen, which makes sense. Postmenopausal people don't have estrogen, right? Another way to explain estrogen deficiency is glycogen deficient vaginal epithelium. Estrogen is full of glycogen. Okay, estrogen is full of glycogen, folks. Okay, so this is a different way of saying estrogen deficiency. Is everybody clear, folks? That's important. Okay, vaginal epithelium. That I mean, because in the OB-GYN, if you miss that, we get yelled. So they always ask you, right? So you have to identify that because there's a steps when you start a physical exam. These are the things, so you would know it, folks. Okay, so that's that. Yeah, this is endometriosis. Everybody clear? All right.